Hello, I'm Jeremy Fernandez. Tonight on The Virus, fears of new coronavirus outbreaks as protesters rally here and around the world. Plus, researchers in Queensland sign a major distribution deal for their potential vaccine after some promising results. But first, Black Lives Matter protests will go ahead in some cities despite concerns about exposure to COVID-19. The rallies against police violence have been a major concern. Hello, I'm Jeremy Fernandez. Tonight on The Virus, fears of new coronavirus outbreaks as protesters rally here and around the world. Plus, researchers in Queensland signed a major distribution deal for their potential vaccine after some promising results. But first, Black Lives Matter protests will go ahead in some cities despite concerns about exposure to COVID-19. The rallies against police violence have been a major concern for health authorities, with large groups of people coming together on the streets. Some states, such as South Australia, have approved the demonstrations, saying no fines will be issued to those who don't practice physical distancing. Other state leaders, though, have issued warnings but are not stopping the rallies from going ahead. In New South Wales, the government has launched a last-minute court injunction to stop any gatherings.
Its popularity's proved the problem.
It had escalated to a potential 10,000 protesters turning up.
So the Premier's stepped in and police applied to the Supreme Court to have it banned.
This is because the protesters could not guarantee adherence to the health orders. They could not guarantee safe social distancing.
Protesters have vowed to turn up regardless.
We are going to march it, they like it or not, because this is our land.
We have a right to speak and a right to express ourselves.
Health orders allow up to 500 people to gather in a public place if they're socially distanced, and police plan to enforce it.
As the 501 turns up, we would be giving them a direction to leave the area, and if they failed to leave, then we could take action. We could arrest them.
But authorities say it's not the cause they're championing, it's the virus they're potentially carrying.
We only need a few people in that crowd that may come to actually have this virus to cause all the good work that our community has done in the last 5 months to come unstuck.
The potential for a second wave and an outbreak of coronavirus is extremely high in New South Wales.
Similar protests are planned in Queensland, Victoria and South Australia, but New South Wales is the only state that's taken legal action.
Well, the Prime Minister's also asked people not to break coronavirus physical distancing rules, telling them to find a better way of expressing themselves. He said anyone who does attend would be putting their own health and the health of others at risk.
Committed to a cause and daring social distancing. Spurred by injustice in America and angered by Indigenous experience.
It's the governments. They're more worried about getting COVID-19.
Outsiders vented over injustice.
Am I threatening you?
No, you're not.
In the very way that Parliament's insiders had just exhorted the nation not to.
Let's exercise our liberties responsibly this weekend. I encourage people not to attend, and I say to them, don't go.
Aware crowd estimates for protests this weekend pointed to gatherings in the tens of thousands. Scott Morrison sought the advice of his chief medical officer.
A mass gathering, even if people try to make it safe, is inherently dangerous.
Translated into ministerial speak,
any mass gathering at this time is a lottery with people's lives.
The settled view of the panel of medical chiefs is that no amount of distancing or hand washing can make a weekend of Indigenous safety rallies COVID safe. And invoking memories of the eerily sparse Anzac Day arrangements, the government's urging protesters to show solidarity in solitude.
Express that concern online, through donations.
Let's find a better way and another way to express these sentiments rather than putting your own health at risk.
The medical advice is now in direct conflict with the convictions of protesters who seem intent on hitting the streets anyway. If they do, they'll set up a test for authorities on who should prevail when a social justice cause collides with social restrictions.
Some of the organisers of these marches say Australia's infection rate is low enough to justify these demonstrations. This week, reported cases have stayed below 20 nationwide, but there have been some areas of concern. A primary school in Melbourne was forced to close after a prep student there tested positive. Meanwhile, the Northern Territory has marked 33 days since its last new infection.
First a city, then a country, then the world. With reports of deaths on most continents and no vaccine in sight, the questions remain. How far will the virus spread? How many lives will it take?
Australian scientists hope to produce up to 100 million doses of a homegrown COVID-19 vaccine by the end of next year. Today, Queensland researchers signed a major partnership deal with a pharmaceutical giant, but it's still too soon to say whether the vaccine will work.
The funding deal with CSL and the Coalition for Epidemic Preparedness Innovations means the first human trials can begin as soon as next month. 120 people will be tested to see if the vaccine's safe. All going well, 1,000 people will then trial the vaccine next year, with the hope of making 1 million doses available soon after.
Obviously, the team's extremely confident in the technology we've produced. We already know that this vaccine produces high levels of antibody that can neutralise the virus.
CSL and the University of Queensland have a good history. Together they produced the cervical cancer vaccine. That took 15 years. The COVID-19 research is being fast-tracked.
We recognise this is high risk, but the science is very strong. If we're successful, we know we can scale this up and make millions of doses.
Worldwide, there are more than 100 COVID-19 vaccines being developed, with a handful already in human trials. So far, only researchers from China have published results of their vaccine trials on patients in a medical journal.
It's still relatively early days, and so we are learning a lot about this vaccine every day as we start to progress it and scale it up.
If all goes to plan, and that's a big if, the University of Queensland scientists say their vaccine could be ready to roll out mid-2021.
Well, that development has highlighted the opportunities for increased funding in the health sector. While the crisis has exposed some shortfalls in Australia's pandemic preparedness, many experts are saying there's never been a better time for reform and to rethink funding priorities. The AMA's Dr. Chris Apala and health economist Angela Jackson shared their analysis earlier.
Lessons around preparedness for PPE, preparedness for testing, for example, we're probably caught a little unawares with the scale of the requirement of those things and where we were going to actually get those products from. I mean, if you can believe it, it seems like most of the world's supply of surgical masks come from Wuhan. And so I didn't know that before this pandemic happened, but clearly looking at our supply lines and making sure that we've got if possible, domestic supply or stockpiles of these things, but a readiness to quickly upscale for testing. We don't want to run out of testing kits and so on. Quickly upscaling those sorts of things so that we can respond to pandemics in the future.
We have this question here about whether the pandemic is giving certain states and territories cause for concern about their funding arrangements going forward from here. How do you see that playing out?
Well, they've actually just signed a new agreement. So around hospitals, the state and federal governments have just signed their new 5-year hospital funding agreement, securing funding going forward. So there isn't a lot to be worried about there. There was some concern as well for the state hospital systems in particular. Even though with the pandemic, we thought there was going to be a lot of extra healthcare and healthcare use, that didn't eventuate. And so actually the funding of hospitals was sort of put in jeopardy, if you like. And the Commonwealth has guaranteed that funding. So the picture isn't looking that bad, especially for the public health system. On the private side, there are some inherent problems there in terms of private health insurance that were evident before the crisis that may be made worse by the economic downturn, so people dropping out of private health insurance. So that might mean some of those concerns about the viability of private healthcare sort of become more pressing, if you like, over the next 6 to 12 months.
Dr. Zappala, can you weigh in on that question about health insurance, private health insurance and its place in this post-COVID world and how affordable it might be and what burden that might put on funding arrangements for the public health system?
Look, I agree completely with what Angela just said there. I think we need to recognise that the balanced system that we have between public and private is a strength of our system, not a weakness. And there's no way that legions of patients could shift over to the public system and everything work as before and it cope. So we need a robust and viable private system, and that means that people need to be taking out private health insurance. And as Angela alluded to, and as everyone probably knows, the rates of private health insurance were trickling down steadily before coronavirus, and now with increasing affordability concerns across the board, you can't imagine that that's going to get any better.
Jonathan O'Brien has this question about whether you expect any major changes to the way doctors and patients interact during diagnosis. And one of the things we've seen come very much to the fore during this period has been telehealth. How well is that working when doctor and patient can't actually be in the same room at the same time?
Well, mixed success, to be honest. The Australian Medical Association has been asking for telehealth to be added to the armamentarium of consultation options available for all healthcare professionals, but obviously doctors. For a long time now, and the coronavirus, and this is one good thing that came out of the coronavirus, sped that all up so that we now have that available. I think we should very much regard it as an addendum to normal face-to-face healthcare. There is no substitute for eyeballing someone in the same room, reading all of the non-verbals, being able to examine them, obviously, and have a proper interaction between doctor and patient. And that should never be replaced, and we should never allow that to be replaced. However, if you already know your doctor, for example, and you're just following up the results of tests, or you're just checking that some symptoms have resolved, then that's, I imagine, a quick consultation that would lend itself to telehealth. So as an addendum, it is definitely very helpful, and we would like to see it stay as part of practice, but it will need a little bit of definition around how it's going to best be used.
Dr. Zappala, I want to get your forecast of the medium to long term about how health policy is going to be shaped by this pandemic and what the best opportunities now are in front of us.
There is still shall I say, more to be done in the public hospital space that recognises the critical role that they have, not just in medical care service delivery, but in training, research and other activities like that. And coronavirus has shown exactly the sorts of extra things that public hospitals have to do and an extra burden that they have to take on. And we need to recognise that in the funding system and make it simplified if we can.
Angela, I'll get your view on that. One viewer I'll just mention has written in suggesting that the defence budget should be cut in favour of funding hospitals, medical research, firefighting, climate change, transport, education, all that sort of thing. It's kind of an amusing question, but it's also a serious one because this is the very burden and the very difficult choices that the government's going to have to make in recovering from this pandemic, isn't it?
It is indeed. So I think what this pandemic has shown is that the health system is vital to our economy. So the two are interlinked. And what I hope to see going forward is a real appreciation of that, and that to see healthcare not as a cost, but as an investment. And if we can get that mindset right, then I think we can overcome a lot of the problems that Chris has alluded to around fragmentation across our health system, around the equity of access issues across our health system, and really drive what is an excellent excellent system that serves us very well to the next level. And so Australians can really enjoy, I think, the healthcare system we all deserve. And I hope that's what comes out of this, that rather than seeing health as a cost, we see it as an investment and something that's critical, not just to society, but to the economy.
Angela Jackson and Chris Sapala there. The Queensland Premier has apologised to the family of a Central Queensland man whose death was wrongly attributed to COVID-19. 30-year-old Nathan Turner from Blackwater was declared Australia's youngest coronavirus victim after initially testing positive, but multiple subsequent tests have all come back negative. The state's chief health officer says nothing could have been done any differently and that the government had no choice but to rely on the department's advice.
We hope it doesn't happen again, but I can't rule that out. I mean, we just have to take the health advice as it comes.
What they should have done was do further tests to make sure that they knew what they were dealing with.
Is it the testing? Is it the people conducting the testing? All that sort of stuff. There's a lot of questions.
Well, globally, the number of known infections is now above 6.5 million. More than 380,000 people have died. More than 108,000 of those have been in the US alone. And just before we go, the New South Wales Supreme Court has refused to allow a Black Lives Matter protest march planned for Sydney due to fears of sparking fresh coronavirus clusters. Justice Desmond Fagan said to allow the protest to go ahead would go against the current advice of health officials. That is the latest from all of us. Stay safe. Goodbye.